Good morning. My name is Rita, and I have been with Meadowlark Hills for the past 7 years in the finance office. Today, I am presenting information for resource preparedness for caregivers. As you follow along, please note that you have a packet of handouts for you to read at your convenience. Journey, a time that came possibly unexpected, both clinically and financially. You may live with someone who has dementia or may have a family member with dementia. I hope Module 4 will give you resource information that will help answer some of your questions. I believe that if you start early, this will help you prepare for the caregiving journey. It allows the loved one to help with decision-making process, and as a caregiver, you will know what your loved one may need or want to help you help them with some of the answers. The first thing that I recommend is that you organize your paperwork and information. Start a filing system with important papers so you can find the information easy. It will save you time when you're dealing with so many other issues. Start a notebook or binder. This will be a notebook that holds answers to questions after talking to so many people, insurance companies, doctors. You will need copies of insurance cards, copies of the medications. Write down the names of the people who you talk to. This will be your tracking system. Ask for help. Reach out and develop a network of people who will be willing to help you. Your family, your church, your friends. Join a support group as those who came before you blaze the trail with information. Learn or update caregiving skills. There are no instruction manuals on caregiving. Update your caregiving skills will help you be better at everything you do for your loved one. On the other side, offer to help. If you know of someone who is a caregiver, you might ask if you can help them. Maybe they don't know how to ask for help, and asking may help them help with the caregiver journey they are going through. Plan for your own care. Support groups will be able to share with you their experiences and what has helped them. Take care of yourself. The rewards? The caregiving journey create bonds that deepen through care and companionship. New relationships form through education and support. Unexpected rewards develop through acceptance. First area is medical insurance. I have found that it's very hard to understand from the point of who pays for what on what medical procedure. You have handouts in your packet that explain the medical Part A, Part B, and Part C, which is the Medicare Advantage plans, and Part D, which is the prescription plans, along with how supplemental insurance, the Medigap policies work. When bills start to come in, you will be able to understand who has paid for what. This section belongs in your binder of information. A person may have long-term care insurance coverage. This is not a traditional health insurance. It is designed to cover long-term care services and support services, including personal and custodial care. Long-term care insurance policy reimburse policyholders for a daily amount. Know where your policy is and who it is with, so questions can be answered. Oftentimes, a long-term care insurance policy might be sold to another company and the name has changed. You will need to know how to start a claim and how soon to start that claim. Each policy will be different. For those who have served in the branch of the military, there may be VA assistance through a variety of ways. You will need the DD-214, which is the discharge papers from the branch of military you have served in. If you do not have access to those papers, please contact your local VA office. I have included some information on the VA centers in the state of Kansas, and the local Manhattan VA site can be contacted by calling 785-350-4920. The The Aging and Disability Resource Center, the ADRC, is a trusted source of information where people of all ages, abilities, and income levels and their caregivers can go to obtain assistance in planning for their future long-term service and support needs. Staff at the ADRC provides objective information and assistance to help people access private and publicly funded service programs. I have included in your packet a list of the Kansas Area Agency on Aging locations for you to call and ask about possibly in-home services, transportation, home-delivered meals, and other services that you and your loved one might need to help in the caregiving journey. I'm asked about legal information. The Kansas Legal Services provides civil legal advice and representation at no cost or at a reduced fee to income-eligible individuals. It can be elder law, power of attorney, consumer finance, housing, health and individual rights, or some of the services that can be discussed with them. Kansas Legal Services will be able to answer the question on why would a power of attorney designated for health or finance be so important. If you are not able or they are not able to help you, then you can be referred possibly to a private attorney who may help you for a small fee. I again have included a brochure for you in the packet of information provided. Social Security. I have talked with many people who really don't understand the amount that Social Security pays them each month. For example, how much is the Part B premium? Why is it deducted? Why is the Part B premium even deducted? What does it cover? What are their taxes being taken out? Is the Part D premium being paid from their monthly Social Security check? Each January, Social Security will mail out a New Year statement, and this is information you will want to keep in your notebook. I have included a list of Kansas Social Security offices, and you can go to their website at www.ssa.gov. They will be able to answer questions about disability benefits through Social Security. Kansas Medicaid is a jointly funded state and federal government program that pays for medically necessary services. Medicaid pays for medical service for children and disabled, blind, or 65 years of age and older. I have attached several different contacts information, brochures, and lists for local offices in your packet, so please contact them if you have questions, if you feel like that you may qualify for a Kansas Medicaid program. Researching for this module, I found that Kansas has a program called the Kansas Lifespan Respite Care Project. It is a new program that surfaced when I researched the project, and I have put an article in your packet that explains it. But it is to help you obtain some respite care if you are on your caregiving journey. As our final slide appears, I wanted to let everybody know that Meadowlark Hills has many, many programs in their memory program here at Meadowlark Hills. A lot of the programs are free. You do not have to live at Meadowlark Hills to come and partake into these programs, and sometimes there's a small fee. But the person you should contact is Michelle Hobb, and she would be able to answer any additional questions on the programs that I have listed on this slide. In conclusion, I hope I have presented information that will help you on your caregiving journey. Your notebook should be filled with information that will answer your questions and guide you forward. Thank you for your time and interest.